So, good afternoon, everyone. It's been a long day, but thankfully, this is the last presentation. This talk is from a researcher's perspective that I hope will complement David's talk, and from a federal government perspective, and Kevin's from a LIP perspective. So, my involvement in measurement dates back to a SHRC-funded research project on social cohesion and family transformation. A few of the researchers, myself included, were demographers who enjoy working with numbers. And thus, the project included measurement of social cohesion, which is somewhat analogous to measuring welcoming communities, and integration, though not specifically focused on immigrants. I brought that experience with me when we work on gathering baseline indicators of welcoming communities in Ontario. I gave a presentation to faculty and graduate students at Western's Migration and Ethnic Relations program on developing measures of ability and willingness of communities to welcome newcomers with data from the baseline indicators. I did that mainly because it was a 1-hour talk, and giving a talk mainly on baseline indicators would have been excruciating, both for me and the audience. So my talk this afternoon will focus on that project. An offshoot of that presentation was a more developed measures of communities' ability to welcome and integrate immigrants, first presented in an international population conference and in the 2013 P2P conference. Some of you may have been there. From feedbacks on those presentations, it looked like the measure, especially on welcomeability, was kind of interesting and probably promising. There was a chance to do a similar project we did on official language minorities. As that project used the same data set used for the Ontario baseline project, namely the 2006 census and the 2008 CCHAs. If you'll notice, this part was just 3 pages of the 60 or so pages of the report. So now, I will not discuss these concepts in detail, as you are familiar with them. It would be good to keep them in mind, though, as I go through my talk. This is a measure of outcomes, as opposed to measurement of processes. This involves a number of dimensions, at least at 2 levels of analysis, community and individual level, and has an underlying aim of comparisons over time and across geographic units. While we take welcomeability, or the ability of communities to welcome and integrate immigrants, as a separate and a different concept from integration being the participation of immigrants in economic, social, and political life of the community, often measures of integration of immigrants at the individual level are used as indicators of welcomeability of communities. So those are separate, but then we use these measures. So then, there are challenges in every stage of measurement of welcoming communities, mainly because of the multidimensionality of the concept and the multiple indicators for every dimension and every varied measurements of indicators. You are familiar, and many of you have done the first of these stages, as can be seen from your reports, your websites, and from the presentation here, not only by Kevin, but from the presentation this morning, notably by Christian and Chela. So then, to determine the dimension to measure, let me just get over that. To determine the dimensions to measure, we mainly relied on the literature review by Esses and colleagues on characteristics of welcoming communities, which I will talk about shortly. A quick internet search reveals there are other models that have been developed, which I will not discuss in the interest of time. The selection of indicators for its dimension among the many data that have been found or collected could be done by experts through some statistical methods, such as structural equations modeling, or by agreement amongst stakeholders, mentioned by Kevin there. This last method has been done by some of you through committees or councils formed for this purpose. To obtain summary measures for each dimension, say for economic or social dimension, common relative measure that I will also discuss shortly can be used, or use some mathematical transformation, or rank order the values in similar way. So you need to have similar measures. Finally, if you only need one summary measure, such as a welcomability or an integration index, if you have to derive that, there is a need to assess the importance of each dimension. For example, whether the economic dimension is more important in integration than, say, social integration. This may be done by relying on experts, by using some theoretical framework, or by, again, agreement among stakeholders. So, the LIPs in Ontario may be familiar with these 17 characteristics of welcoming communities, as they were asked to rank the importance to them of these characteristics. Their responses showed that availability of employment opportunities was the most important, followed by availability of affordable and suitable housing. So we used this framework for analysis, categorizing some of those characteristics, many of which data were available or could be made available, into those dimensions: economic, social, political dimensions. These are characteristics of communities for which indicators could be derived from individual level data. We also included these two characteristics of communities: municipal features and services sensitive to the needs of newcomers, and presence of newcomers serving agencies. So we had these requirements for data. Data must be 2006 or later. This must include immigrant status, and most importantly, the data set must include information to identify geographic units covered by LIPs. The sources of the data that met this criteria were this. I will show examples of the data from the first three sources. In this table, which is probably too small for you to see, but in this table, the data are categorized by immigration status, meaning for total population, non-immigrant and immigrant, with immigrants further broken down into established, recent, and temporary immigrants for each of the LIPs. Each of the LIPs are listed in the first column. In our report, we also show the breakdown for the then 15 LIPs in Toronto, which since then has been reconfigured to just fewer LIPs. This is an example of data from the Canadian Community Health Survey. CCHS is surveyed with fewer respondents than the census, and thus the immigrant category cannot be broken down into further categories. Likewise, statistical tests were made to see whether the differences between non-immigrants or immigrants are significant. There is this, what we call this LQ, location quotient, which I will discuss later. Now, in slide 10, the data for this table came from Ontario 211. We counted the number of agencies serving immigrants, then used the numbers from the census to have an approximate measure of the number of immigrants per service units. You'd notice that this table is numbered 84A. The 270-page report includes several more tables. So then, from these several tables, a self-appointed expert, that is me, we need to have just fewer indicators, as Kevin said. So I chose 13 indicators. 13 indicators arranged by dimensions for economic and health, which in earlier framework shown is roughly placed under economic dimension, social dimension, and service dimension. Some are absolute measures, such as employment rate or mean income. Others are relative, such as values for immigrants relative to non-immigrants. Okay, now this shows the values of the 13 indicators for each LIP in Toronto. these values are useful in themselves, as has been shown by previous presentations here. However, the value of one indicator cannot be combined with any other indicator. That is, these are apples and oranges. So, as mentioned earlier, there are a number of ways of deriving common metric. Here is one called location quotient, wherein the value for Ontario is set to 1, and the values for the LIPs are measured relative to Ontario. That is, the value for a LIP is divided by the value for Ontario. Now, combining these values is now possible and could be done by dimensions. For example, combining indicators 1 to 8 could yield a measure of economic and health dimension. 9 to 10 could yield something about service dimension, and 11 to 13 could be social dimension. In this table, the values for all 13 indicators are simply added to get one score, and that is in the last column, but it's too small there, so I made it in the next slide. I call this the integration capacity index. So this seems, if you can see, this seems reasonable, with Peel region, Toronto, and York region getting a score higher than the average for the province of Ontario. But notice that Smith Falls also gets an average, above average score, which I didn't expect, indicating that perhaps there is in a check the values and measures used, which you mentioned there could be problems with some of these measures. So I have actually checked on the data, but it will take time for me to explain why this score is what it is. So then these results was a motivation to try another way of coming up with summary measure. In the paper that was presented in the 2013 P2P conference, we came up with what we call welcomability index. Since I have already presented this in 2013, I will only mention briefly what we did and results we got. Here we also have LIPs in Ontario, but added the then 15 LIPs in Toronto, giving us 45 units of analysis. For this, we also considered the use of data from baseline project, the one that I mentioned earlier, including the census and the CCHS. The main difference is that here we use structural equations model. So we went statistical. Rather than just an expert deciding on the indicators, we went for mathematical stuff. So then more details can be there we go. More details can be seen in the paper that is available through the internet. So here we considered several indicators, and this structural equations model that provided a good statistical fit had these indicators. Yeah, had these indicators that were included, and then there is also the list of those that were not included. Remember, it is mathematical or statistics that made the choices, so to say, right? So what's nice, though, aside from the mathematics doing this for us or statistics, another output from a statistical equations model are the correlations. We get those relationships between included variables, which I will not discuss here. So now, just to show you, this map shows the rankings in terms of welcomability based on the scores obtained from the structural equations modeling. High in rank are York, Peel, Durham, all adjacent to Toronto. And this map shows the results for the original 15 Toronto LIPs with a high rank indicated by the green dots over there. So then, having done this for Ontario, we were motivated to do something similar for the whole of Canada. A chance came when we did a study on official language minority, also using the same data sets. However, the study made use only of the public use microdata files, and thus we could do the analysis only for big geographic units, such as CMAs and non-CMAs. To be able to do the analysis for LIPs, as was done for Ontario, we need to use data accessible only through Statistics Canada's Research Data Center. Furthermore, the geographic configurations of the 2006 microdata file were different from those of the Canadian Community Health Survey. Thus, we may do with just using variables from the 2006 census. This lists the variables from the 2006 census that we considered for economic and social dimension, with indications as to whether or not the variable was selected for structural equations model. This slide shows the scores and ranks for social and economic dimension for welcomeability. And based on these results, Vancouver is first in welcomeability, and most of the non-CMAs rank very low. This shows the map of the top 10 welcoming communities based on the structural equations modeling done. As you may have noticed, these efforts at measuring welcomeability were done as extra or appendage to a project. That is, we did not have a research project whose sole purpose was to measure welcoming communities. We did these extra efforts because we saw opportunities to do them. Remember, we're demographers, and when there are data sets, we have this itch to analyze this data, to tell us what can the data tell us. And of course, the other reason is because we enjoy doing this stuff. So then, if we are to do a research on welcoming communities, what will that project look like? For one, on the community level, the project could come up with welcomability indices for areas covered by LIPS or RIFs. It could aim to measure the integration of individuals and then examine the integration of, say, vulnerable groups or specific groups. How are they integrating into society? We could analyze the impact of service, we could examine the effect of the level of welcomability of communities on the immigrant integration. We could also analyze the impact of service provision on immigrant conditions. Such a project is probably better done by regions and comparisons made over 2 or 5 year periods. An advantage of such a dedicated project would be the use of common concepts, common measures, and common geographic units. So, the good news for such a project is that data are available or could be made available at the community level, at the individual level, immigrant level, and for service provision. As David has mentioned, some of these are already there. It's just a matter of looking at them and analyzing them. So then, some of the data that can be made available soon, they were already collected, are the 2016 census, the 27, CCHS. Perhaps the Statistics Canada would do another general social survey. We don't know, but yeah, it's possible. And of course, surveys can be done, and as you said, qualitative data, we can have focus groups. So all of this are possible. This kind of project cannot be simply an academic pursuit. It cannot be just the researchers doing this, because the yield in terms of publications in journals will most likely not be plentiful. Rather, this kind of a project must be motivated by its usefulness for communities and for immigrants, as you mentioned, and thus would require collaboration and support from you, LIFs and RIFs, and of course from government agencies like the IRCC and Statistics Canada. Thank you.